Welcome to another episode of What is Hashimoto's with Dr. Martin Rutherford. To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com. And now, here's Dr. Rutherford.
Okay, we're going to talk about Hashimoto's and Epstein BARR virus, the holy grail of Hashimoto's, or at least it used to be. So I'm in Reno, Nevada, and about 40 minutes from here, there's this beautiful small village up in it's called Incline Village, Nevada, and there is a doctor who discovered years ago that Epstein BARR virus probably had something to do with chronic fatigue syndrome. This was before anybody knew about Epstein BARR virus, and so we had a lot of patients in common, and it was interesting to see. His thought was deal with the immune system, kill the virus, and so on and so forth. I'm not saying his name because it didn't feel like it went very well. But he was the first one to recognize that Epstein BARR virus could have some sort of an effect on this fatigue. It turns out, in the end, if it does have an effect, it probably has an effect because it can be one of the viruses that affects your thyroid. And you'll notice I said one of the viruses that affects your thyroid. Now, I'm getting a lot of questions on Epstein BARR virus because, and I don't remember the gentleman's name for a variety of reasons because I don't want to remember his name, who just wrote a book, I think it was last year, The Medical Intuitive. I actually am not like adverse to medical intuitives. I don't know for sure, but I've seen some pretty impressive stuff from them. But this gentleman, an author, one day just had a flash out of nowhere that it was Epstein BARR virus that was causing all Hashimoto's. So he basically wrote a book on it. And he said, and then pretty much his model was the model of the original doctor who started Epstein BARR virus, which is a doctor named Dr. Datis Kharrazian, who is still probably the world's most reputable expert on it and does research on it to this day and is a clinician. And so he kind of ripped off Dr. Kharrazian's stuff and it made a lot of people think that it was all Epstein BARR virus. So that's the baseline of what I'm going to say, okay? Because Epstein BARR virus can be a trigger. There are 39 known triggers of Hashimoto's. They are a ton of food sensitivities. There are some minerals, believe it or not, that people think they should be taking for Hashimoto's that will actually make them worse. There are lots of lifestyle factors. I mean, I think it goes without saying, insomnia, sedentary lifestyle, smoking, alcohol, drugs, not sleeping properly, unhealthy relationships are huge. I'm sorry, but if you're like in a battle with your significant other and you're divorced or you're going over child custody things, I mean, I've just seen that. That goes to the next one of stress. Imbalance in blood sugars is another one, okay? So these are a lot of the 39 triggers. Everybody's a little different. One could be 4 of those, one could be 2 of those. There's chemicals. The chemicals have gotten a lot of play over the years because the alternative medical profession, their world is pathogens. Their world is come in here, let's try to find out what it is, let's take out your metals, let's give you a shot, let's do a chelation, let's chelate your metals out of there. Let's take the pesticides out. And there's a certain amount of truth to that, but these metals and these chemicals may or may not even be a problem, and there's still about 10 of them that are legitimately potential triggers for Hashimoto's. You throw those in with the probable 10 or 11 food groups that can be triggers for you. You throw those in with all the lifestyle factors I just put in here, and then you get the pathogens, which I actually put near the end of how I would evaluate a Hashimoto's patients. And probably the number one pathogen by far that affects Hashimoto's is not Epstein BARR virus. It can be one of them. Probably H. pylori is on the top of the list. There's a bunch of other ones. If you get if you're drinking water out of a mountain stream, or you're going to other countries and you're picking up different types of parasites, Candida can definitely be one. Hepatitis C can definitely be one. Cytomegalovirus can be one. Herpes virus 6 particularly can be one. Parvovirus can be one. Lyme definitely can be one. And then Epstein Barr virus is kind of in with that group. And then there's a lot of confusion on the Epstein Barr virus. I had a patient yesterday, I talked to her, she said, well, I tested positive for Epstein Barr virus. I said, what tested it? She said, I don't know. So there's now a panel for Epstein Barr virus, and it'll tell you, it'll give you, it's 4 markers for Epstein Barr virus. And so they test different aspects of the immune system's response to Epstein Barr virus. And there's a way from that panel to tell you if it's active or just been hanging around for a long time. A lot of these pathogens, this is, if you've ever seen our Lyme stuff, this is like the core of what we talk about on Lyme. And a lot of these pathogens are thought to be cured sometimes, but they're not cured. They're smart. They're smart. Let me use the example of antibacteria resistance, what's the word I'm looking for? Like penicillin. Come on, antibiotic. Thank you. Antibiotic resistant bacteria, and it's a problem. And so the people are dying every day. Kids are dying because they took so many antibiotics for so many different things, and then there's this virus, which are smart viruses, or bacteria, which are smart bacteria, figured out how to get around the drug. These viruses are kind of like that. Those of you who are Lyme patients, you've got this all memorized. Everybody comes in here with Lyme is fully bought into the model. But a part of the truism of that is the virus does hide and so on. So it turns out a lot of these do that. And Epstein Barr virus is like that. So they can kind of hide until you become compromised, and then they can kind of express themselves, and the next thing you know, if Epstein Barr virus is an issue, then what I'm looking for is do you feel like you have Epstein? Do you feel like you have a viral infection? Do you feel like you have an active viral infection? Are you getting chills? Are you getting feel like you got the flu, and you get sweats? You get swelling in your lymph nodes and all that type of stuff? Or are you not? If you're not, there's a good chance that the Epstein Barr virus is not a player. Those of you who have Hashimoto's thyroiditis, where you're tender and it gets swollen and then it goes and it gets swollen and it goes. Now in my world, Epstein Barr virus moves up the list on being one of the possible or probable triggers for that type of person. And that type of person, the patient or prospective patient I was talking to yesterday, went and got, I don't know if it was 1 shot or several shots of lysine for it, no change. She didn't have the type of symptoms that would make me think that a virus or a pathogen was part of it. And so again, there's a lot more to this, and in the defense of the it's all metals and it's all parasites and it's all Epstein Barr virus and it's all Lyme groups, all of these thought processes developed during a time when it was the wild, wild west relative to fibromyalgia and chronic fatigue and these types of things, because nobody knew what was going on, so everybody was grasping. And as commonly done, those people started following the medical model. Oh, it must be a bug that we're going to kill, and then the person's going to get better. Well, we're a couple of decades into understanding that that is not the case, that these are multifactorial problems, that there's vicious cycles all over the place. The biggest thing you have to do to be successful in treating these types of cases is to be able to figure out the whole picture to the degree that you can before you even start to execute anything on the patient. And that's where Epstein Barr virus is. It's in there. It's in there. I've had patients where, they came in, they came from another doctor. The other doctor did a really good job. Maybe the Epstein Barr virus wasn't checked. We checked. They had a little tenderness, flu. We checked it. The next thing you know, we gave them some lysine. We gave them some other things that'll dampen viral. And there's like half a dozen things or more. We gave them a couple of those things, and oh my God, it's a miracle. Like a couple of days later, they were better because they had already taken care of the other things, and they had the presentation of Epstein BARR virus. And I think this is the weak spot in a lot of our education. We've kind of eschewed. We've tried to don't do exams anymore because we don't get paid for them. People don't get paid for them, and they take a long time. And doctors need to take 8 minutes to see you and all that. But you kind of have to do an exam, a little bit of an exam, to go, man, that feels like you got a viral infection. You can pick it up in the history, but it's kind of nice if you go, and they go, oh, that's tender, it's swollen. Was it swollen last week? No, it comes and goes. And well, now I'm going to look for maybe a viral infection or one of these other pathogens. So that's kind of skinny on Epstein BARR. So for those of you who have bought that book, and actually a lot of stuff in that book on the treatment is good because it came from somebody else who knew what they were talking about. But it's not all Epstein BARR virus. I want you to put that out of your head. If you had a positive Epstein BARR virus, you don't have a lot of this stuff. Don't keep looking for the cure for Epstein BARR virus. Start looking for what the other 38 triggers might be. All right. Okay, I think that covers it. Talk to you again next time I talk to you.
Thank you for joining us for another episode of What is Hashimoto's? To find out more on any of our topics, or for information on scheduling a consultation with Dr. Rutherford, please visit us at whatishashimotos.com.